being a medical legal consultant, I get a lots of calls from the country. And yesterday, I got a call from interior of Maharashtra. And the most shocking for me, it is doctor versus doctor. Now I realize if doctor's family get admitted to hospital and they get same treatment which normal patient gets, their feeling definitely going to empower them to look to other patient. Now this case, where she has admitted her mother to the hospital for fever, 4 days, mother was in hospital and same day probably doctors planned to discharge. But when she went to the hospital and seen diagnostic report, she was utter shocked to say that creatinine level was higher side. Of course, more concerned being a doctor, she discussed with the internist of ICU and other doctor, but no one has allowed her to speak to treating doctor. Now, when she gone little deeper, it has been told to her that treating doctor is highly egoistic and don't speak to anyone. My friend, patient's rights are there, and when we are treating a patient, they got all the right to know all this. And there is definitely conflict happened. Now this doctor, knowing all this, have decided to take action because this was her case. When she discussed with me, of course, Nursing Home Act of Maharashtra very categorically described the patient's right, which every patient may be knowing about it. And if at all ego, attitude, behavior of ours have not been changed, it is going to be a troublesome. So let's wait to get knowledge of Nursing Home Act in coming videos. Thank you.